This conference will now be recorded.
Good afternoon. My name is Christy Nance, and I am the Policy Director here at Oral Health Kansas. This is our Friday noon call series. Today is April 19th, and these are just calls that we do every other week throughout session, and they are intended to be an opportunity for us to provide legislative updates, some advocacy education, and then also just an opportunity for you guys to ask questions that you might have throughout session or just about advocacy in general. Really, anything is open. The focus of today's call is on dental reimbursement rates. We're going to talk about the history of rates in Kansas, research from other states, and what rates look like in Kansas moving forward. This is something that throughout legislative session, Oral Health Kansas has really had a focus on dental reimbursement rates. And so we wanted to share kind of why we thought it was important to work on this year and how it impacts other states and could potentially impact our state. So the history of dental reimbursement rates in Kansas specifically, the current rates are on average 35 to 40% of what commercial insurance pays.
Hey, Christy?
Yeah.
Can I interrupt you? I don't think your slides are showing.
Oh, no, oh my gosh, you're right.
Okay.
I'm not sharing my screen. Thank you. How about now? Better? Okay, I'm assuming you can see them now. Thank you. Yes, so the current rates are 35 to 40%. So that means on average, so that means that, some procedures are covered up to like 85%, while others only receive, like 10, 15% of the average dental fee. So it's quite the spectrum, and 35 to 40% is still very low for an average. That other 60% is really just coming out of the dentist's pocket. There's really no other way that they're being able to pay for that. So it's costing them a lot to see our Medicaid population. So that has been the rate since 2001. So it's been about 18 years since it's been raised. And we have been seeing a declining dental provider network in Kansas due to this low reimbursement rate. At Oral Health Kansas, we receive calls pretty regularly from consumers having difficulty finding a dentist in their community that accepts Medicaid or that is accepting new Medicaid patients. And from research, we found that approximately 30% of dentists in Kansas are enrolled in Medicaid, so about a third of them. So while we were gearing up for session and thinking about reimbursement rates and what we wanted to be like an ideal reimbursement rate that we would like to see, we did a lot of research, and one of the main studies that we looked at was the effects of Medicaid reimbursement rates on access to dental care. And it was produced by the National Academy for State Health Policy in 2008. They studied 6 states and the impact reimbursement rates had on access to dental care in those states. So all of those states had implemented an increase in reimbursement rates, and they studied that impact that it had. The 6 states were Alabama, Michigan, South Carolina, Tennessee, Virginia, and Washington. And in that study, they cited that dentists usually have 3 primary reasons for low participation in their state Medicaid programs, and that was low reimbursement rates, burdensome administrative requirements, and problematic patient behaviors. Some of the key findings from this study, they found that while dentists often seek reimbursement rates that mirror their usual charges, states have seen gains in dentist participation and patient utilization with rate increases that don't necessarily meet that threshold. And so what they found was that really the rates just need to be high enough that they're at least covering the cost of providing the service. And they found that to be estimated at 60 to 65% of what a dentist would typically charge. And so that is the number that we chose to advocate for this session, was 60 to 65%. In the 6 states that they examined, provider participation increased by at least 1/3 and sometimes more than doubled following rate increases. So that was a big reason that we felt like approaching the reimbursement rate would be a way to help increase our provider network in Kansas. And not only did the number of enrolled providers rise, but so did the number of patients treated. And they found this through data that showed increase in access to care. And so the two data sources they used were the percentage of enrollees receiving services had increased, and then also that enrollees had encountered less difficulty in finding care. And Alabama and Michigan also reported receiving fewer calls from parents unable to find a dentist. So we're hopeful that in Kansas, if we're able to increase the rates, that at least Oral Health Kansas, hopefully we'll stop receiving as many calls because people are able to find a dentist. The second study that I looked at was done by the Connecticut Health Foundation, and it was called The Impact of Increased Dental Reimbursement Rates on Husky A insured children. And it was published in 2013. And the state had approved a rate increase to the 70th percentile of 2005 private insurance fees. And they wanted to study the impact that this had on specifically children being able to access a dentist. And Husky A stands for Healthcare for Uninsured Kids and Youth. And so that's kind of like Connecticut's Medicaid program for children. Some of the key findings from this study focused around dentist participation. They saw increased participation specifically from private practice dentists. They saw that private practice dentists participated more than doubled between 2006 and 2011. And it resulted in approximately half of all pediatric and general dental practitioners providing care in the Medicaid dental program. So they had great success in raising their reimbursement rate. They also worked with their Medicaid department on some administrative, kind of simplifying some administrative work for those dentists. And so that also kind of resulted in this large increase in participation. And they also saw increased utilization rates. So utilization rates of children continuously enrolled in Husky A increased from 46% in 2006 to nearly 70% in 2011. And more than twice as many children received treatment services in 2011 than 2006. And so between this study and the National Academy for State Health Policy study, the one that I talked about previously, they talked about how not only were they seeing an increase in the number of dentists that were enrolling in Medicaid, but they were also seeing dentists serve more of a Medicaid population, mainly because they can't afford to see a large percentage of the population with low reimbursement rates. And so as those reimbursement rates were increased, they were able to accept more patients into their clinic. So it had a great impact on utilization. So the current status of rates in Kansas, we advocated this year, like I said, for a 60 to 65% rate for dentists on Medicaid. And actually both the House and the Senate picked it up in their budget. So this is what the House had. It was add $3 million, including $1.3 million from the state general fund to increase Medicaid dental reimbursement rates for fiscal year 2020. And the Senate had language that would increase the rates to 50%. So they didn't have like a set number in there, but it would just increase the rates to 50% instead. And in conference committee, they decided on the House version, which was this one. And it's not finalized. They will finalize the budget when the legislature returns in May. But I will add this is definitely lower than 60 to 65%. We were kind of estimating that we would need around like 10 to 12 million to reach that 60 to 65%. So this is significantly less. And so we do see that there is still some work to be done, but we were just really encouraged and excited to see an interest from the legislature in dental. It really didn't take a whole lot of hard work to get them to pick this up. They seemed really excited from the beginning that this was something that they felt was important, and clearly saw it as an issue in our state. And so we were really encouraged by that, and really thankful to the committee for picking this issue up. So we're excited that hopefully there will be this increase in reimbursement rates in 2020. So kind of talking about how there is still more work to be done around reimbursement rates. We will be tracking the number of dentists that are enrolled in KinCare. So we'll start tracking that now, and then in like 6 months or right before session starts, we will once again look at how many dentists are enrolled, because we want to see if this did have an impact on our provider network. And if it didn't, we can use that data and research to show that we need a bigger increase to have that impact on our provider network that we need in Kansas. So we will, we're planning on advocating for another rate increase in 2020 if this doesn't have that impact on our provider network that we need. And since I talked a little bit about the legislature, I just wanted to let everyone know that they're on adjournment right now until April 30th, and they will return on May 1st for a veto session, and they will be in that session until they conclude everything that they need to get done, including the budget. So sometimes, it's a couple weeks in May, sometimes it goes through June, so you just never know. So that is all that I had today. I know that was a lot of information, so I will pause and see if anyone has any questions about the studies that I shared, or about what we're doing at Oral Health Kansas to be advocating for this issue. And I will say you can either put your question in the chat box, or you can also unmute yourself. That's an option as well.
Hey, Christy, it's Scott Brenner with Aetna Better Health of Kansas. I'm listening here with Tanya.
Yeah.
I just had a quick question, I think. So with the money that's in the budget right now, do you have an idea of what the effective date would be for the rate increase going forward? Assuming it gets passed in the final budget bill?
Yeah, I believe, and Tanya, correct me if I'm wrong, but I believe it will go into effect in June, at the end of June.
My understanding it's for state fiscal year 2020, which would begin July 1st. There's a lot of logistics, so I guess we'll have to wait and see how that'll turn out. But my understanding is it would be for the state fiscal year, which begins July 1st.
Okay, yeah, thank you. Great question, Scott. And I will say that I know we've worked closely with the Kansas Dental Association on this as well. I should mention that. But I know that we will be working, if this does pass, on kind of what that $3 million will go towards. So will it go towards like all of the services, or will there be certain ones that we try to increase the rate on? So that will be a next step as well. Do we have any other questions? All right, well, I will add that if you think of something after we get off the call today, that you are always welcome to email me. My email is there posted on the screen, and I would be happy to answer your questions. And this will also be posted on our website under the Advocacy tab. You can find all of our previous recordings, and I will post this one as well if there is someone that you think would benefit from this call. So I appreciate you guys all joining today, and I look forward to our next call. Have a great weekend.
Thanks, Christy.